GH treatment may have beneficial effects on the cardiovascular system. Growth hormone is a well-known and widely used therapeutic modality to treat renal insufficiency in children. How about adults with kidney failure? With regards to this topic, I'd like to draw your attention to the clinical evidence that we have found in the published medical literature. And I'm quoting here. Clinical and experimental studies demonstrate that long-term safety of this treatment, growth hormone replacement therapy, in subjects with impaired and normal kidney function. Growth hormone was shown to increase the renal synthesis of the anti-aging hormone clotho in healthy subjects and patients with CKD, indicating that GH treatment may have beneficial effects on the cardiovascular system. One more quote from another article. The promising short-term results and notable secondary findings observed even in this underpowered trial, it remains to be hoped that human growth hormone therapy will be given a second chance to demonstrate efficacy in improving patient survival and well-being on dialysis, ideally in a better defined clinical sample and with a more extended commitment to the industry sponsor. What can I add from myself? Perhaps only one thing. Growth hormone is a super useful and powerful therapeutic tool when used correctly and properly by the well-informed and knowledgeable person. This conversation would not be complete without bringing up the topic of gray areas surrounding GH. The first one being the topic of possible association between the growth hormone and occurrence of cancer. The best way to find out if such association or correlation exists is to look into the meta-analysis. The meta-analysis is a statistical analysis that combines the results of multiple scientific studies, which has the highest level of evidence. According to the meta-analysis published in the journal Oncotarget in 2016, based on the results of 2 retrospective studies and 7 prospective studies conducted in Germany, Sweden, UK and United States, involving 11,199 study subjects, the growth hormone replacement therapy was associated with a decreased risk of cancer in adults with growth hormone deficiency. Let me repeat again. The analysis of 11,191 study subjects included in the clinical trials on the growth hormone replacement therapy suggested that growth hormone replacement therapy was associated with a lesser risk of cancer in adults with growth hormone deficiency. Another review article, even more recent, published in Annals of Pediatric Endocrinology and Metabolism in 2019, and I open quotes here, the available evidence does not indicate an increased risk of cancer within the length of follow-up currently available, especially for low-risk children. The available data suggests that recombinant human growth hormone treatment does not substantially increase leukemia risk in patients without prior high risk. The use of recombinant human growth hormone as a replacement treatment to accelerate growth and improve adult height appears fully justified in conditions where therapy replaces an unequivocal deficiency." Unquote. Another quote from the Journal of Endocrine Reviews 2019, titled "Growth Hormone Links to Cancer," concludes that, and I'm quoting directly, Replacement growth hormone therapy in growth hormone deficiency hypopituitary adults and short children has been shown to be safe when no other risk factors for malignancy are present. And one more quote. This time, I will quote myself. Human growth hormone is arguably one of the safest hormonal therapeutic modalities when it is used correctly.